Saya juga ingin menyentuh sedikit berkenaan dengan pemberian dos penggalak dan juga dos ketiga. Di sini saya ingin maklumkan bahawa ada perbezaan antara dos ketiga dengan dos penggalak. Dos ketiga diberikan kepada mereka yang mana respons sistem imun mereka terhadap dua dos tidak mencukupi dan memerlukan dos yang ketiga untuk respons sistem imun yang optimum terhadap ataupun untuk melawan Covid-19. Dos penggalak adalah bagi mereka yang mana dua dos sudah cukup dari segi respons imun, tetapi dalam beberapa bulan respons imun itu sudah mula turun, dan dos penggalak itu telah akan diberi sebagai perangsang kepada sistem imun supaya ia lebih berkesan terhadap Covid-19. Sekarang ini kita sedang membangunkan garis panduan berkenaan dengan pelaksanaan pemberian dos ketiga dan juga dos penggalak yang akan dibentangkan dalam mesyuarat JKJAV yang akan datang. Dan saya yakin bahawa kita akan mula memberi dos yang ketiga dahulu. Selepas itu dos penggalak bermula daripada bulan depan, apabila kita sudah dapat pandangan dan juga kita sudah dapat panduan clinical guidelines daripada pakar. Dan yang ketiga, kita telah buat pendaftaran bersama dengan NPRA. Hari ini syarikat Pfizer telah pun hantar dossier mereka untuk dos penggalak dan dos ketiga kepada NPRA, dan kita akan lulus secepat mungkin.
YB Alifa from Good Look. I have a couple questions, YB. Firstly, can you clarify on which immunocompromised groups are you referring to when you speak about third doses? Is it elderly people in general with chronic diseases, or healthcare workers without immune system problems? And also, I'd like to point out that Pfizer's application to the FDA is a booster shot, not third dose. So can you clarify that?
Yeah, so we will come up with the clinical guidelines once the recommendations have been brought to JKJAV. Then we will update the clinical guidelines on the booster shot and the third shot. And also we take note that, of course, Pfizer's submission is for a booster shot. So for the third dose, we will make a decision internally based on the guidelines that will be submitted to JKJAV.
Yeah. And just another question, if I can ask. You mentioned a lot about vaccine inequity. So do you think that Malaysia is now part of that global vaccine inequity problem with our booster program? Why aren't we heeding WHO's call for a moratorium?
First of all, we are part of global solidarity. Although we are a middle-income country, we participated in COVAX very early on, and we are a full-paying member of COVAX. One. Secondly, we have also participated in the donation of vaccines. You all know the news has been covered many months back that we sent vaccines to Bosnia at the height of their pandemic. Third, there is no wastage of vaccines in Malaysia. Compared to developed countries, where we hear news of vaccines that are being wasted, that are not used past its expiry date. All vaccines here are being used, and we don't hoard any vaccines beyond what we need. And I think that's a crucial difference. Malaysia, we're using whatever stock we have. But in case we do not require the supplies to be delivered, we've made a decision to say that we can defer. We can defer our delivery so that vaccine manufacturers who are contracted to us can send to other countries first. That's the decision that we've made. On the booster doses, that's why we haven't announced boosters for everyone. I think it would be not fair if we announce boosters for everyone right now when there are countries who are not even given their first dose. So our booster and third dose program now is very targeted to those whose immune system may not have gotten enough of a response from 2 doses. So I think a targeted booster and third dose program, I think, is fair. But I think the issue here is those countries who have vaccines that have gone past the expiry date. I think that is very, very wrong. Yeah?